Hi, I'm Dr. Stephanie White, Chief Medical Officer for Western U Health. Thank you for agreeing to volunteer with us today at our Western U Vaccine Clinic. We will be distributing the Pfizer vaccine, which is given in 2 doses 21 days apart. There are multiple roles for volunteers at our clinic. The first job is what we call a Wayfinder, and they do, as the name indicates, help people find their way. This is a good job for someone who may not have a strong medical background and is new to our community. You may escort folks from their car, help them find a restroom, and make sure that they remain on the path through the building and don't deviate into a classroom or another area that may not be appropriate for them. Wayfinders also help our eligibility team ensure that anyone who's standing in line is appropriately arriving at our clinic today. So they'll answer questions and make sure that if anyone's confused about what identification they need, whether or not they have an appointment, they can assist those individuals. The second step is eligibility. This role is ensuring that everyone who's coming through the clinic is appropriately scheduled and appropriately screened. The first thing we do is verify that they have an appointment for the day. We then check temperature to ensure that they don't have a fever and screen for any recent COVID contacts or COVID symptoms. The other role for eligibility is ensuring that patients that are getting vaccine today are in the appropriate tier. The tier is set by the Los Angeles County Department of Public Health and changes frequently. It will be important to check in with your team leader to ensure that you have the accurate information for this week. Tiers are based on occupation, place of residence, as well as age. The next stage in the process is what we call medical screening. The main role in this station is to determine how long we need to observe a patient after they receive the vaccine. For patients that have normal levels of risk, we only observe for 15 minutes following the vaccine. They'll get a happy face yellow sticker. If a patient has a history of anaphylaxis or any concerning condition in which they may not tolerate the vaccine well, we observe for a full 30 minutes. They'll be given either a red or a pink sticker depending on the day. Once a patient completes their medical screening, they're then directed to a registration desk. In this area, they'll be checked into the computer system, and it will be marked whether or not they're going to receive the vaccine in the right or the left arm. They'll also be given their vaccine card. If any issues come up regarding their appointment, incorrect information, we have a troubleshooting area specifically for those patients to make sure that all of their issues are addressed prior to receiving the vaccine. Once the patient is registered, they are then directed to a vaccine station. Health professionals here, including preceptors for health profession students, will make sure the vaccine is given correctly. Immediately following their vaccine station, they're then directed to observation, where they will wait the 15 or 30 minutes. The licensed practitioner in the observation area has access to medications for allergic reactions or any other concerns the patient may have, and can answer medical questions about side effects, when the next dose is needed, as well as technicalities regarding how to schedule the follow-up appointment. Once a patient completes their observation period of time, 15 or 30 minutes, they're then free to go home. In the evening, they'll receive an email telling them how to schedule their follow-up appointment, assuming this was their first dose today. When you check in the morning, we're going to ask you to sign in, place a name tag on, and also sign a waiver to participate. If this is your first time returning to campus in a while, we'll also direct you to get a rapid test before you start your shift for the day. If you are an hourly employee employed by Western U, it's very important that you get your routine breaks, 10 minutes as well as your lunch break. If you're finding the clinics really backed up, please check in with your team leader for the day to make sure that they can cover for you while you take your appropriate breaks. Additional important ground rules: remember, this is a HIPAA protected area, so please don't share any information that you may observe while you're working your shift. Additionally, no photographs or videos can be taken in patient care areas. Once we complete our morning welcome each day, we'll have each team break out with their team leader, and you'll get more specific instructions and training relevant for that day. For health profession students, we will do everything we can to give you an opportunity to practice your vaccine skills during the clinic. But you may be asked to cover a non-medical area so that we can make sure the whole clinic works well together. Thank you again for agreeing to participate, and we look forward to seeing you.